Hey, this is Doug Frigo, the king of medicine, the editor, creator, writer of the Placebo Journal, one of many. This is the Placebo Journal Podcast. What you're going to hear is a true story of medicine, and then Vance Lassie and I are going to talk about it afterwards and kind of dissect it, but also give you some inside scoop. I hope you enjoy it. It is not safe for work, not safe for anybody who doesn't like cursing or gross stories. So just be aware. I hope you enjoy it. Thank you very much. Magnets. My story begins as a fourth year medical student at a large inner city emergency room. I was doing a required rotation, taking 12-hour shifts and working closely with an intern as well as an attending ER physician. I enjoyed the fast pace of the big city ER, but did experience significant anxiety when a code was underway or was imminent or there was a major trauma unfolding. The attending wanted me to see patients, wanted me to try to assess them and formulate a plan, part of the learning process. I went to see what seemed to be my 100th patient this shift. Miss Green Jeans was a 76-year-old female who presented with nonspecific pelvic discomfort. She had the usual past medical history, including diabetes, tobacco abuse, alcoholism, substance abuse, the stuff that we were seeing in that hospital. She also had hypertension, renal insufficiency, on and on and on. Her abdominal exam was unremarkable, but as we all know now, and what I was taught then was no abdominal exam is complete without a pelvic exam. The 40-bed ER was nothing more than a large room separated by pull curtains that do provide some visual privacy, but do not provide much privacy in regards to conversation. In other words, everybody can hear what everybody was saying. The whole ER, including patients, staff, etc., can hear every word I said to this patient. Miss Green Jeans was morbidly obese and hard of hearing, so the pelvic exam would likely be difficult, but considering that I had done 2 pelvic exams in my entire career, including this one, I thought I could handle it. Miss Green Jeans was placed in what's called the lithotomy position. That's where people who give birth kind of have their legs splayed out. Now, I needed help lifting her from the nurse because one, nurses are much stronger than doctors, and two, because all doctors have, quote, a bad back, end quote, and three, because the patient's legs resembled large, soft, fleshy bags of cottage cheese. I reached for a speculum, not realizing that they can actually come in different sizes. By chance, I just chose a medium sized one and inserted it into the vagina, which enveloped the whole thing. It was basically gone. Unfortunately, due to the size of the patient, I couldn't even see the labia minora nor the speculum anymore. The ER nurse who was chaperoning my exam recommended a change of equipment after we got the other speculum out. What you need is the old Mississippi, she said. I looked up at the nurse with total confusion on my face as she handed me a jumbo sized speculum resembling a small fishing vessel or at least salad tongs. I again inserted the instrument to get a better look into the vaginal vault. Words could not describe the horror and disgust as I watched several hundred maggots squirming to exit the outside world. I jumped back suddenly, nearly falling on my butt. This can't be happening to me. Why me? I quickly ran over to my attending to tell him the news, and he casually walked over to the business end of the exam table and confirmed my diagnosis. Yep, those are maggots. He then informed me that I should tell the patient her diagnosis and then proceed with cleaning them out of there. This sounded like a plan, but why me? Why now? Oh my God. I stood up at the head of the exam table and in my best doctor voice I said, Miss Green Jeans, you've got maggots in your vagina. Suddenly, the busy ER seemed so still, so quiet. It was eerie. I was sure everyone in the department could hear my every word. Miss Green Jeans looked at me with a confused look on her face, and then she yelled at the top of her lungs, Magnets? How the hell did magnets get in there? The end. All right, here we go. Vance, maggots.
What's up, Doug?
Maggots, dude. It's what's for dinner. Talk to me.
So what are we doing here, man?
All right, so listen, this is the first episode of the Placebo Journal podcast. People are hungry for the Placebo Journal. Is it coming back? I'll never say. There's thoughts of a best of. But what I can tell you is I'd like to read these stories, these true but weird stories, to kind of have you and I comment on it. Who the hell are you? Vance, you worked for
Just a
us.
minute, Doug. What are you talking about? What's the Placebo Journal?
If you don't know what a fucking placebo journal is, then you should be on this channel. So let me just say, it's the only. It was the only medical mag. Wait, it was the only medical journal that was funny on purpose. What the hell did I used to say? Something like that.
I think we said the only medical journal that was designed to make you laugh, or
On purpose.
yeah, to make you laugh on purpose.
Yeah, it
Yeah,
was
something like
idiopathic,
that.
idiopathic wit and wisdom. For those who don't know, it went out every other month for 10 years. Vance came on after a couple years. Vance, why did you come on to the Placebo Journal to help write?
So I was in residency at the time. So I grew up on reading Mad Magazine and uh, zany comedies, and had a subscription to Mad Magazine my whole childhood, you know. And then I I was in residency, and what happened was, um, there was um, a Christmas Secret Santa in our residency program, and every time somebody would get a gift on their desk from some mystery person for the Secret Santa, they would send out an email to the entire giant residency program, and all the nurses and doctors and residents and everything, saying, "Hey, whoever it was, thank you for the candy or whatever it was." And so every day we were all, and they would send the email to the entire business. So every day everybody was getting 30 emails, anonymous thank you emails from the anonymous gift, and it was annoying me to death. And so I wrote this thing that was a gag from Mad Magazine, where, or similar, where basically it's a one size fits all generic thank you letter that no one ever has to send one again. Just everyone just take this and fill it out and put it on your desk. And it was like, dear blank, thank you for the blank. And then down at the bottom you could choose from options for the, like, a Mad Libs kind of, to fill in the thank you
Right.
note. And it worked out to, like, dear anonymous stranger, thank you for the whatever sweat soaked Chewbacca mask, and it would go on. I was really depressed today because blank, and then you choose off the list. It's like I ran into a brownie scout on the way. I ran over a Cub Scout on the way to work or whatever, and the chocolate, the chocolate covered dog treats really made my day or whatever. And so I put that together and I sent it out to the entire residency. I'm like, seriously, people, stop sending out these thank you notes. Just use this one or whatever. And anyway, one of my attendings read it, and she comes running out to the residency room, and she's like, Lassie, this is amazing. And she's like, this is exactly like stuff in the Placebo Journal. And I was like, what the heck is a Placebo Journal? I've never heard of that before. And she's like, what? And so she went. So she was a subscriber. So she came and brought me one. She's like, I found out about this at a conference a couple years ago, and I've been a subscriber. So she gives it to me, and I mean, I read it cover to cover, like right then. I probably had patience waiting. I'm like reading, maybe not, but I read it like immediately. And so that's whenever I reached out to you. I sent an email to you saying, hey, you never met me before, but I've been writing stuff like this my whole life. I grew up on this stuff, and you and I should be working together. So that's how I reached out to you. And then you basically emailed me back, and you're like, that's fine, but I won't pay you.
And I never did, and I never will. It's just,
I don't do it for money. I do it because I like to write stuff that makes people laugh, man.
dude, I didn't make money with it either. We kind of broke even,
No.
lost money for a while. It went for 10 years. You can probably see it over my shoulder at the top the first year of the journal. But it was therapy that I needed personally, that probably the HMO wouldn't allow me to get as I was
Yeah.
being a doctor.
That's what it was for me too.
You know, and I think, like,
If you can't laugh, you cry, right?
well, that's the thing. That's what physicians go through. When you look at the story I actually narrated about the lady with magnets or maggots or whatever. Um, I mean, we're not trying to make poke fun of the patients. We're trying to look at the side of the physician. We're not. It's not humorous in that respect. We're just kind of seeing how weird and true stories affect us. And like that was an example. It came in issue number one of the Placebo Journal. I actually know the person who wrote that, but I'll keep it anonymous. All true, and this is not uncommon. I mean, the way that I loved in that story, how the attending walked by and said, "Yep, those are maggots." Like, he's seen it before. It's like, dude, what? And it does happen. I mean,
Yeah.
usually when you think
Uh,
about it, remember in Gladiator, that's what they use maggots for, to help clean the wound. Now, I'm not sure we can truly say this lady had a wound in her vagina, because that seems a little weird. But I mean, it must have been some bacterial infection that the maggots felt quite at home at. But just imagine, as a fourth year, because we went through that. I had some incredible
mhm.
stories that some I put in the Placebo Journal, just to share because people don't think these things are real.
Yeah, no, the stories this we in the Placebo Journal for anybody listening who didn't read the Placebo Journal, there a pretty significant segment of every episode, every issue was what we called a true stories of medicine, which were sent in by most of the time were sent in by readers. Sometimes they're our own stories, but for everybody who's listening to this who's a physician, you know that there's just these stories of things that happen to you in medical school, residency, or in practice that you can't make this stuff up. And
No,
people love hearing stories like that. I mean, even lay persons, non-medical people, kids. Whenever I go talk at the high school and stuff, they want to hear these crazy stories. And I mean, seriously, they are so crazy. You can't make these up. That is so crazy. It has to be
and
true,
all the names,
And
we changed all the names, and
of course, everything's anonymous,
and
right?
these stories now are 10, 20 years old, and they were 10, 20 years old when they were told. So some of these things are 30 years old. But I have about 600 of these stories, I believe, in the Placebo
Mhm.
Journal over those 10 years. So the goal of this podcast was to narrate a story and have you and I, or someone else we bring on with you and I, whatever, to kind of bullshit about it and bring a little levity, but also just kind of show the trauma we this is see the trauma in medicine now is all administrative drag, but there's also the trauma of just
Mhm.
truly being a physician and seeing stuff that you have to, because honestly, dude, people get grossed out on a zit. I could have cut open a rectal abscess and eat a sandwich at the same time by the time I was practicing, right? I mean, it was never a problem.
Oh, yeah.
It didn't bother me at all. So but think about
Yeah.
what
Oh, yeah.
the process. I remember this, how hard it was to see in anatomy, gross anatomy, and seeing dead bodies. And this one, she was a young Indian girl in medical school, very petite, very, was so well dressed and very shy. And I was like, really, she was traumatized. I remember seeing it, but like within 2 months, she was walking around with a leg over her shoulder. It was the most bizarre sight of my life. She's walking with the leg kind of hanging over her shoulder, bringing it to another table. It's like, oh my God, how quickly can we get thick skinned? That's the way it is.
You mean like Tom Sawyer walking along with his fishing pole or
Right.
whatever?
It
Like
was like
she's
or
just
like a
got some
hobo,
guy's leg on her
like
arm.
a hobo with a sack. They just walking by with a leg. I'm like, what? This is the same person who I thought was going to pass out on day one. So the thick skin, and it's important because you have to be like that to survive. It's really it's hard on you emotionally. It makes you very disconnected, unfortunately. But you need that connection sometimes with patients, but also you need that thick skin, or you can't practice this job. You can't be a doctor. Those are my thoughts.
So you think we're gonna read true stories of medicine, just share
Yes.
those stories with people. Are we gonna share other jokes from the Placebo Journal, tell some top 10 lists and some of that kind of stuff?
We
What do you
can
think we should
possibly
do with
we
it?
can possibly do that. I think I got to play that by ear. I was thinking about, and I'm still pondering doing a best of the Placebo Journal, but that's just a huge project that would take me. It's still going to take me years. I'm not sure where I'm going with that, and I don't know if I'd ever reboot that because the effort, though I am retired, the effort is just massive. It was massive to do, and there's a cost to that, which I'm not sure. So if this podcast went crazy, we would consider anything. I'm open to anything, but money talks all the time. But um, I just think people will be interested in hearing at least the true stories. We can talk about sharing some of the other ones, and then. But I'd like us to comment on this one because people don't realize, this guy in the story was a fourth year medical student doing his second pelvic, and that's what he sees. That's just unbelievable.
So should we play the clip and then talk about it?
No, I mean, by the time this podcast went on, we had the clip going, so they've
Okay.
heard they've heard the clip.
So
So
everyone's already heard it. Okay, great.
yeah, so you and I were prepared for this anyway, so they've heard it. They can send in some of their own stories if they want. They can make comment. They can criticize us for doing this. I don't really care. Not really going to listen to that. But I just thought it'd be fun to start this process, and we'll just keep going if you're open to it.
Yeah, absolutely.
Any closing thoughts or wisdom? Any idiopathic wit and wisdom?
Oh, I don't know. I mean, with regard to this audio clip, I mean, this story, do you want to share examples of our own stuff like this, or is it more just, hey, here's a story from the listeners from over the years, or the readers, you know?
Well, let's just say Vance is still in practice, so I think you need to be careful about sharing any stories. I'm retired. I don't give a shit at this point. I would, and I'm never going to share someone that I'm trying to poke fun, hurt somebody, do it in a way that's disrespectful. I will share some of the uh, craziest things I've ever seen, and laughed at. But I'll keep that for another episode, and we'll go from there. We'll just wing it. If people have any recommendations on what they want to hear, and maybe if they want to hear some of the top tens or some stuff from the Placebo Journal or some jokes or whatever he had in there, just tell us. Sound good?
Yeah, absolutely.
All right, man. Until next time, we'll talk again.
Sounds good, man.
All right.